Hi everyone, we are going to look at a very interesting topic in pharmacology, antibiotics. Antibiotic is the most commonly used drugs in the hospital, and this antibiotic operate based on some key principles. They are drugs used in the treatment of bacteria. They are otherwise referred to antibacteria. The common principles of antibiotic use or how the antibiotics kill the bacteria include it destroys the cell membrane of the microorganism, it interferes with the protein synthesis of the microorganism, it interferes with the genetic formation of the microorganism, it damages the cell wall. There are some drugs, there are some classes of these antibiotics. The classes include sulfonamide, beta-lactams antibiotics. These include drugs that fall under penicillin, the quinolones, the tetracycline, and cephalosporin. We are going to look at the sulfonamides. The sulfonamide are rapidly absorbed from the intestinal tract. They are metabolized in the liver and excreted through the kidney. The metabolic sulfonamide tend to form crystal in the acidic urine. Example of sulfonamide is cotrimazole, which is commonly referred to Septrin. Cotrimazole, which is commonly referred to Septrin. The drug comes in 480 milligram, which is sulfametazole, sulfametazole 400 milligram plus trimethoprim 80 milligram. We will discuss these drugs under the following heading: the classification, mode of action, indication, contraindication, the dosage, side effect, and nursing implication. The classification of cotrimazole, it falls under the class antibiotics or sulfonamides. Antibiotics, which is a broad spectrum antibiotic, or the sulfonamide. The mode of action, the drug kills the bacteria by interfering with the use of para-aminobenzoic acid. Para-aminobenzoic acid, that is PABA, para-aminobenzoic acid, a precursor of folic acid. Para-aminobenzoic acid is a precursor of folic acid. It interferes with folic acid metabolism at the phase of conversion to folinic acid. Folic acid is commonly used by the bacteria, and this folic acid is usually converted to folinic acid. At the point where the folic acid is converted to folinic acid. That is where the drug interfere. It interferes with this conversion. The moment folic acid is converted to folinic acid in the bacteria, the organism becomes very active. The drug destroys the bacteria by damaging the precursor, that is the para-amino benzoic acid. Indication: what conditions do you use this drug? Chronic bronchitis, urinary tract infection, or we can say chronic bronchitis or other respiratory tract infection, common cold or coryza. You can use it for urinary tract infection, typhoid fever, conjunctivitis, pneumonia, cancer chemotherapy, respiratory tract infection, HIV or AIDS treatment. It is commonly used as an adjunct in the treatment of HIV/AIDS. It is also used in the treatment of shigellosis. The contraindication of sulfonamide include it. You don't give this drug to patients that are having hypersensitivity to the drug or hypersensitivity to trimethoprim. You don't give the drug to somebody with porphyria, renal impairment, hepatic impairment, blood disorder, hyperthalamia. The dosage: 1 tablet of cotrimazole come in 480 milligrams. Adults usually take 2 tablets, that is 960 milligrams as a dose. 960 milligrams as a dose. It is usually given twice a day, that is BD. The drug also comes in suspension or syrup form, and it is given based on the recommendation. Half the adult dose, which is 10 mils of the suspension, contain 480 milligrams. 5 mils of the suspension contains 240 milligrams. The side effects: diarrhea. The side effects include diarrhea, headache, hyperkalemia, vomiting, rash, blood dyscrasias, allergic reaction. It is commonly manifesting on the skin. The allergic reaction is usually shown on the skin of the patient, which occur like pruritus or rashes. Another one is Steven-Johnson syndrome, erythema multiforme, fever, crystalluria. All these are the side effects of cotrimazole. Nurse implication: what should a nurse do when administering cotrimazole? 1. Obtain specimen for culture and sensitivity tests before then continue the treatment. Obtain specimen for microscopy, culture and sensitivity tests to discover or to dictate the bacteria. As the specimen is collected, the drug can be commenced. Secondly, administer drug on an empty stomach 1 hour before or 2 hours after meals. with full glass of water. The absorption of the drug is faster on an empty stomach or 2 hours after meal. And give the drug with full glass of water to maintain hydration. Encourage patients to increase fluid intake to avoid crystallization of the kidney. The drug should be taken with full glass of water. Observe patient for signs of superinfection, example, fever, sore throat, and fatigue. Report to the physician any sign of blood dyscrasia, example, skin rash, sore throat, fever. Monitor patient for signs of allergic reaction. Always monitor the patient for sign of allergic reaction. Always subscribe, like my channel, and comment. Thank you.